Let's talk about a couple of those procedures that we mentioned a little bit in our first segment. I think we talked about endarterectomy. What are those, doctor? And we're looking at a picture right there. That's a procedure that you would do, correct?
So this is, yes, this is an artist's depiction of the carotid endarterectomy. It's a little, I wish it always looked as clean as it does in the picture. But our goal is to, like I said, open the carotid, the internal carotid artery like a book, and use that spatula that you see there on the left lower corner to separate the plaque from what's remaining of the carotid wall that is healthy. Once that is completely removed, you're left with the open vessel. Just as a side, you know, during this procedure, you realize that the supply to the right side of the brain is stopped because you have a clamp controlling the blood flow. If the carotid artery is bleeding, you can't really work. You know, you can't see. So we use a plastic tube called a shunt that we insert on the lower portion of that picture and on the higher portion so that the blood can have some way of getting into the brain.
While you're doing the procedure?
While the procedure is being done.
Of course, because you can't stop it.
Well, it's a surgical debate. There are surgeons who say that you can do this fast and not require a shunt. I'm sort of a religious shunter, so to speak. I like to shunt, and I feel that that's a little bit safer. But,
I like that too.
But that's debated in most surgical, just to be fair. It's debated in more surgical meetings.
And how long does that procedure take? I mean, it looks pretty dramatic, but you said just about an hour and a half?
In good hands, it would be an hour and a half to 2 hours. And that would include the eventual duplex ultrasound on the table that will assure that the flow is what we want it to be before we actually close the patient.